Before you light up that cigarette, I would like to present to you with some facts about the effects of nicotine and smoking. This will help you to make an informed decision before you subject yourself and others to its effects. What is nicotine? Nicotine, according to the American Heart Association, is a highly addictive substance that occurs naturally in tobacco. Nicotine in its various delivery forms of cigarettes, cigars, pipes, chewing tobacco is one of the most heavily used addictive drugs in the United States. Cigarettes are the usual method of administration. The American Cancer Society tells us that there are over 4,000 chemicals in cigarette smoke, and at least 69 of those are chemicals that cause cancer. Nicotine goes straight into the lungs and is quickly absorbed by oxygenated blood and pumped through our body and brain. Nicotine reaches the brain in 10 seconds and the rest of the body in 20 seconds. That is why cigarettes are the preferred delivery system. As the nicotine activates neuronal nicotinic receptors, it intensifies the activity in the neurotransmitter dopamine in the nucleus accumbens. Nicotine triggers brain's reward systems, causing a pleasurable sensation, which is the major cause of addiction. The addiction of cigarettes has been compared to that of cocaine. Some of the psychoactive effects of nicotine are what I would like to discuss next. Nicotine can be both a stimulant and a relaxant. Nicotine, if taken in short, quick puffs, releases lower levels of nicotine in the blood. It causes the glucose to be released from the liver and epinephrine from the adrenal medulla. It affects the serotonin and dopamine in the brain. It causes tremors, increases behavioral activity, alertness, and facilitation of memory. Some of the central nervous system effects are: it increases the blood rate, the blood pressure, it inhibits stomach secretion and bowel activity. If taken in deep puffs, it can become a relaxant. It releases high levels of nicotine in the blood. It depresses the passage of nerve impulses, producing a sedative effect. It enhances the effect of serotonin and opiate activity, producing calming, pain-killing effects. Chronic use of nicotine leads to brain and behavior changes. Tolerance happens rapidly, decreasing some of the unpleasant effects like dizziness, nausea, and vomiting. Tolerance leads to unmasked pleasurable effects, leading to further use. Chronic ingestion leads to physical dependence. With development of physical dependence, further use is necessary to avoid withdrawal effects. Nicotine is one of the deadliest poisons in existence. It exceeds the status of strychnine, rattlesnake venom, arsenic, and cyanide. In small therapeutic doses, the side effects can be nausea, headaches, dizziness, fatigue, diarrhea, respiratory stimulation, increase in blood pressure, tachycardia, and osteoporosis and dependence. In large doses, it causes confusion, hypotension, seizures, respiratory depression, and death. According to the Surgeon General, cigarette smoking is a major single cause of cancer mortality in the United States. According to the American Cancer Society, tobacco use is responsible for almost 1 in 5 deaths in the United States, and about 1/2 of Americans who continue to smoke will die from complications of this habit, which is more than alcohol, car accidents, suicide, AIDS, homicide, and illegal drugs combined. Smoking is a major cause of heart disease, aneurysms, bronchitis, emphysema, and stroke. There are many other ill effects that can happen because of using cigarette smoke. It reduces fertility, higher risk of miscarriage, premature birth, stillborn, low infant birth weight, gum disease, cataracts, hip fractures, and sexual impotence, and many, many more. Here are some of the effects of cigarette smoking. Here is a smoker's lung, and this is a picture of lip cancer. When an individual tries to quit smoking, they will experience withdrawal symptoms. A smoker's nervous system becomes accustomed to functioning with nicotine. When a smoker stops and reduces his nicotine intake, he will disturb the balance of his central nervous system, causing withdrawals. Some of the withdrawal symptoms are cravings for tobacco, irritation, anger, weight gain, concentration problems, depression, headaches, fatigue, constipation, restlessness, insomnia, dizziness, and anxiety. According to the American Cancer Society, 70% of people want to quit, of smokers want to quit. 40% try, 4 to 7% succeed with help, and there's an 80% relapse rate.
Go.
So now that you are aware of the risks involved with nicotine and smoking, you can make a well-informed decision before lighting up.